We're gonna do some under eye treatments with Hannah. And Hannah's our nurse here at the Paragon. She's been helping me, and she'd actually perform some of these procedures as well too. We're using a new product by Allergan. It's called Volbella, Juvederm Volbella. A lot of these new products have something called Vicross technology, and that really allows the augmentation of the tissues without having a lot of swelling or having a lot of problems with changing the sort of the color of the skin, what's called the Tyndall effect. So you're seeing a little bit of that with Bellatero as well too. But Volbella's been a great product. We do lips with Volbella, but it's one that you really don't have that stiff cardboard feeling like. So it's great for under the eyes and other places. This, of course, is an off-label indication. With this, there's no indication for under eyes with Volbella. So I like when I'm doing the tear trough. And in her, we're going to put a couple, let's have a couple of those ready. We're going to do some injections, and Volbella comes in these 0.6 syringes, so they're really almost like half syringes. And so when I like to use this, I like to put a very, very small aliquot, use very small amounts. You won't get as much of a hydrophilic response to it. And we want to place this under the orbicularis, okay? A lot of Juvederm products, when people are putting them under the eye, if they're doing that and they're putting it in a superficial plane, they're going to get these like what we call Tootsie Roll eyes, or these little worm-like things that happen from all the swelling that occurs. So let's start by working our way through here. And if you want to, Nico, what you can do, I want you to stay on that side. That's fine. I want you just to take your finger and just sort of tap her forehead just like that, and you can kind of do different rhythms and just kind of distract that, and that really helps take away any of the discomfort. Now, Volbella, I'm right here. I'm going to be right down underneath the muscles. So I'm right down. I'm right just southwest of the lacrimal gland. So I'm really, really deep. I'm nowhere superficial. Okay, and we're going to just kind of walk right on the border of the orbicularis muscle, just below it. Okay, so my aliquots are 0.1 cc. We've done 2 injections, and we're going to do one more. And it's, depending on your degree of volume loss, you may or may not need more, but in Hannah's case, she doesn't really need this to begin with. So it's just going to look great. All right, how was that?
Not bad at all.
Not bad at all, right? This is an area when you're next to the infraorbital nerve. It can be very tough to get through, but if we're in the right spots and we're away from the nerve, which usually is about 1 centimeter down from the lateral border of the pupil, then you can really make a nice impression. So here you start to see a little of the tear trough, a little pinch here, not bad. A little bit more sensitive on this side.
Mm-hmm. Not bad still though.
Good. So again, that's 0.1 below the orbicularis. Remember to be really deep there. We don't want to be superficial. Now there are some unnamed vessels in this area, and they do get hit by needles. And it doesn't matter if you take a catheter or cannula versus a needle. You have some people that only use cannulas, and I guess I'll start using a cannula when the manufacturer takes the needle away from me because there's something wrong with it. I think it's more marketing, but I really think that this is the best way, is to be very, very conservative and use small aliquots. Okay, how was that?
Not bad.
Not bad at all, right? Okay, we'll get her cleaned up, but thanks again for tuning in. This is Dr. Bishara from Paragon Plastic Surgery in North Texas, demonstrating some injections. Have a great night.